On the stroke of 12, the Federal Minister of Health Hermann Gröhe and his discussion partners held a moment of silence on the occasion of the Minute of Silence held across Europe for the victims of the Paris attacks. But before that, a lot was discussed on the funds needed in order to equip the healthcare system with staff and technology and to ensure a German-wide all-encompassing high-quality care. Of course, a hospital reform won't end any debate, but I think the hospitals themselves acknowledge that this reform has built a good basis for, first of all, strengthening the care in the wards, further upgrading hygiene, but also encouraging a sensible labor division between basic and regular care and specialization. Probably it is normal that some are warning it will be too expensive, and others have more ideas on how to spend even more money. But still, an important step has been made. Not only the health sector has set itself the task of improving healthcare. The Federal Minister of Education and Research, Wanka, also supports science, which in the end helps giving all patients equal quality in care. Minister Wanka is supporting a funding concept which will help combine and use patient information such as medical reports, laboratory results and image data.
Egal welches medizinische Projekt wir in der Forschung bearbeiten.
The topic of data protection is always a coherent part. This should not be played against each other, but is also on behalf of those concerned that one has that kind of security, that the private data is not abused, that it doesn't go out to any insurance companies who then will calculate a policy. That is an absolute requirement for anyone who makes his or her data available, that these people know they have a very high level of security and can determine what or what doesn't happen with the data. On the occasion of the German Hospital Conference, which takes place at the same time as the Medica, Minister Gröhe categorically dismissed an endeavor by the hospital associations. Hospitals would not take on the service guarantee of emergency care. This would send the wrong signal to the registered physicians.